This is the Emergency Medical Minute.
Okay, so I thought I'd talk about blood thinners. Okay, so what do we use antiplatelet agents for? There's really a really simple thing that most people should understand about antiplatelet agents versus anticoagulants. So what's the difference? Do you know?
One for stents, use one for coagulometers.
Yeah, great. So use one for stents. So that's really the key, is if it's a clot in the artery, you use an antiplatelet agent, okay? So a clot in an artery, be a heart attack or a stroke, then you're talking about using aspirin, or you're talking about using Plavix, or something that's an antiplatelet agent. Where if it's a clot in the leg, like a DVT, or a clot in the lung, like a pulmonary embolism, those are all really low flow clots, and instead of antiplatelet agents, you're going to use anticoagulants. So things like Xarelto or coumadin or anything. So when people even come in and they say, well, what are you on this medicine for? And they have, for example, anticoagulant, you know that they had at one point usually a venous clot. And if they're on an antiplatelet, like aspirin is either preventative, or if they're on Plavix, you know that they had possibly a stroke or something else that they're trying to prevent, another arterial clot. So there's a new study that came out that basically looked at antiplatelets after TIAs and small strokes, which we see a ton of. And the recommendation that they said is that we should actually be sending people from the emergency department on both aspirin and Plavix when they have a TIA with us. So that's a change to my practice, because previously I'd just been sending people on full dose aspirin. It turns out that that's not enough in this recent study to really give as much stroke prevention. And we know after people have a major TIA that their stroke risk is extremely high for the next few weeks. So this basically recommends that you put patients on antiplatelet agents for around 21 days after a TIA or a small stroke. So being a stroke center, I think that's stuff that we should know. Okay, thank you.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.